Every single day, tens of millions of Americans open their medicine cabinet, pull out a bottle they've trusted for years, and swallow a pill they believe is helping them. What most of them don't know is that the FDA has quietly updated warning labels on these exact products multiple times in recent years, adding new alerts about heart attacks, strokes, kidney failure, and in some cases, potentially fatal skin reactions. These aren't fringe supplements or obscure herbal blends. We're talking about the most recognizable, most purchased over-the-counter anti-inflammatory products in America, the ones sitting in practically every household right now. And after spending weeks digging through FDA records, independent lab reports, clinical studies, and a trail of lawsuits that stretches back decades, what I found is something that a lot of people who take these products daily probably have no idea about. By the end of this video, you'll know which 7 anti-inflammatories have raised the most serious concerns among researchers and regulators, and which 2 options have actual science behind them, with a safety record that most people would consider far more reassuring. Stay with me, because some of what's coming is going to genuinely surprise you. Let's start with something that most people don't think about when they open a bottle of Advil or Aleve, or reach for that extra-strength Tylenol. We trust these products the way we trust a stop sign or a smoke detector. They've been in our homes since childhood. Our parents took them. Our grandparents took them. If something that dangerous were hiding inside something so familiar and so available, somebody would have said something by now, right? That's exactly what makes this story so important to tell, because the reality is, people have said something, regulators have said something, independent researchers have said something. The problem isn't a lack of warnings. The problem is that those warnings are buried in fine print, issued quietly through regulatory databases, and never reach the millions of Americans who've been using these products for years without a second thought. Let me give you just one example before we get into the specific products. In November 2024, the FDA processed more than 50 separate safety label updates for prescription NSAIDs in a single day. 50. These updates added new warnings about serious and potentially fatal skin reactions, conditions with names like Stevens-Johnson syndrome and toxic epidermal necrolysis, which can be life-threatening. These weren't brand new discoveries. The data had been building for years, but it took until late 2024 for those warnings to be formally written into the labels. Did anyone send you a letter about that? Did your pharmacist call you? Did you see a news segment explaining what those changes meant for the bottle you already had at home? For most people, the answer is no. That gap between what regulators know and what consumers understand is exactly where this conversation needs to live. Before we get into the 7 products, it's worth spending a moment understanding the landscape here, because it's not quite what most people imagine. When you walk down the pain relief aisle at CVS or Walgreens, what you're looking at is one of the most profitable product categories in American retail. Billions of dollars in annual sales, products that have been embedded in American daily life so thoroughly that most people don't even think of them as medications anymore. They're just items, things in the house, as unremarkable as toothpaste. And that familiarity is, in some ways, the problem. When something is deeply familiar, we stop questioning it. We stop reading the label, we stop wondering whether the dosing recommendations are actually being followed. We assume that if something were genuinely dangerous at normal use levels, it simply wouldn't be on the shelf. But the regulatory system doesn't work that way. The FDA doesn't approve over-the-counter products the same way it evaluates new prescription drugs. And once a drug has been on the market for decades, it tends to carry a kind of institutional inertia, an assumption of safety that isn't always fully earned. What independent researchers have found, time and again, is that long-term use of many common anti-inflammatories carries risks that are far more significant than most users realize. Not hypothetical risks. Documented risks, confirmed in peer-reviewed studies, flagged in FDA safety communications, and in some cases, the subject of massive class action lawsuits and settlements worth billions of dollars. So let's go through them one by one. Part 3. The 7 anti-inflammatories that deserve your attention. 1. Ibuprofen, Advil Motrin. Ibuprofen is probably the most widely used anti-inflammatory in the world. In 2023 alone, it was among the 30 most prescribed medications in the United States, with over 17 million prescriptions, and that doesn't even count the enormous volume sold over the counter. The actual number of people taking ibuprofen on any given day is staggering, and for short-term occasional use, at the recommended dose, ibuprofen has a reasonable track record. That part is true. But here's where things get complicated. The FDA has been issuing strengthened warnings about ibuprofen and cardiovascular risk since 2005, and those warnings have been progressively strengthened over the years. As of the most recent updates, the FDA's position is clear. The risk of heart attack or stroke can occur as early as the first few weeks of use, not after years of chronic use. The first weeks, the risk appears to increase with dose and duration. And critically, the FDA has stated that this risk exists whether or not the person already has heart disease, meaning someone who considers themselves healthy and heart disease-free isn't necessarily off the hook. Research published in peer-reviewed medical literature has linked ibuprofen to kidney damage, particularly in people over 45 and in people who are already slightly dehydrated, something that's extremely common and something most people never consider before reaching for a pill. Johns Hopkins Medicine has documented cases of acute kidney failure linked to ibuprofen use. The National Kidney Foundation has explicitly warned that NSAIDs like ibuprofen can impair kidney function. And the danger isn't always loud or obvious. Kidney damage from chronic NSAID use can develop slowly and silently, sometimes showing up only when routine blood work reveals elevated creatinine levels years down the road. The Cleveland Clinic has noted that over-the-counter ibuprofen may raise cardiovascular risk by around 10%, and that number climbs significantly with higher doses. Now, none of this means ibuprofen is categorically dangerous for everyone in every situation. But millions of Americans are taking it daily, far beyond the 10 days that the Cleveland Clinic advises as a maximum for over-the-counter pain use, and most of them have no idea these risks exist at that level of use. 2. Naproxen, Aleve. Naproxen often gets described as the safer NSAID, especially when it comes to heart risk, and there's some truth to that relative comparison. Some cardiologists have noted that among the common NSAIDs, naproxen may carry less cardiovascular risk than the alternatives. But less risky than ibuprofen is not the same as safe. What naproxen is particularly associated with, and what the FDA's black box warning addresses directly, is gastrointestinal damage, stomach ulcers, internal bleeding, perforation of the gastrointestinal lining. Here's something that most people who take Aleve would find genuinely alarming. The FDA's warning language explicitly states that gastrointestinal bleeding can happen at any time during NSAID use, and it can happen without any warning symptoms at all. No pain, no nausea, nothing that tells you something is going wrong inside. A 2026 meta-analysis published in a major pharmacology journal found that ibuprofen, diclofenac, and naproxen were each linked to at least a twofold increase in the risk of gastrointestinal bleeding compared to not taking an NSAID. For elderly patients, the demographic that tends to rely most heavily on pain relievers for chronic conditions, the risk is substantially higher. Research from Johns Hopkins and other major medical institutions has flagged naproxen as a particularly significant concern for people over 65, and yet it remains one of the top-selling over-the-counter products in America, marketed with a gentle blue packaging that communicates nothing about what's happening in the gut of someone who's been taking it every day for arthritis pain. 3. Diclofenac, Voltaren. Diclofenac has been around for decades and is sold both as a prescription oral medication and as an over-the-counter topical gel under the brand name Voltaren. The topical version became widely available to American consumers in 2020, and sales exploded. Many people prefer it because they assume that applying something to the skin means it doesn't affect the rest of the body. That assumption deserves scrutiny. In 2018, a major study published in the British Medical Journal analyzed data from hundreds of thousands of patients and found something striking. People who started taking diclofenac were significantly more likely to experience major adverse cardiovascular events within 30 days compared to people who started other NSAIDs. Events including irregular heartbeat, stroke, heart failure, and heart attack. The same study found that this elevated risk applied to men and women, across all age groups, and even at low doses. To put it plainly, diclofenac appeared to carry a cardiovascular risk profile that was worse than other common NSAIDs, not better. The researchers also found that starting diclofenac was associated with a risk of upper gastrointestinal bleeding that was roughly 4.5 times higher than in people who took nothing, and about 2.5 times higher than in people who took ibuprofen. A senior FDA official at the time said something that didn't make many headlines but probably should have. The agency had concluded that diclofenac poses a cardiovascular risk even when used at standard doses for short durations. Voltaren gel remains available on pharmacy shelves without a prescription in the United States. 4. Celebrex, celecoxib. Celebrex is a COX-2 inhibitor, a newer class of anti-inflammatory designed specifically to reduce the gastrointestinal damage caused by traditional NSAIDs like ibuprofen and naproxen. The idea was to get the pain relief without destroying the stomach lining. And for gastrointestinal risk, there's evidence suggesting Celebrex is somewhat gentler. The stomach lining issue is real, and Celebrex does appear to cause less GI damage in comparative studies. But Celebrex does not solve the cardiovascular problem. Pfizer, the company that makes Celebrex, found itself in a deeply uncomfortable position in late 2004, just weeks after Merck's catastrophic Vioxx recall, when their own clinical trial data showed that Celebrex more than doubled the risk of heart attack in a large cancer prevention study. The FDA urged doctors to consider prescribing alternatives. Pfizer kept the drug on the market. Today, Celebrex remains one of the most prescribed anti-inflammatory medications in the United States. And while the cardiovascular risk at standard doses may be lower than what was found in that high-dose cancer trial, the FDA's boxed warning on Celebrex is explicit. Cardiovascular risk applies, and it may increase with dose and duration. Critics have pointed out that Celebrex is often marketed as a premium, modern alternative to old-fashioned NSAIDs, at a significantly higher price point. But the fundamental safety trade-offs aren't as favorable as consumers might assume when they see selective COX-2 inhibitor on the packaging. 5. Vioxx, rofecoxib, the drug that changed everything. Vioxx is no longer on the market. It was pulled in 2004, but its story is important enough that it belongs in this conversation, not as history for its own sake, but because of what it reveals about how anti-inflammatory drugs reach consumers, how risks get documented and then buried, and how pharmaceutical companies handle uncomfortable data. Merck launched Vioxx in 1999. It became one of the best-selling drugs in the world. Over 80 million patients took it. Annual sales topped $2.5 billion. What Merck knew, and what consumers didn't, is that internal data showing elevated cardiovascular risk in Vioxx users had been surfacing since as early as 1999. A memo later examined as part of litigation showed that Merck statisticians were flagging heart attack numbers that looked troubling. The company's response was not to pull the drug. The response was to argue that the competing drug, naproxen, was protecting hearts, rather than acknowledging that Vioxx was harming them. A study by Merck's own researchers, eventually published in the New England Journal of Medicine in 2000, omitted 3 heart attacks that had occurred in the Vioxx group. Those omissions weren't added back until years after publication. By the time Merck voluntarily recalled Vioxx in 2004, research published in The Lancet estimated that 88,000 Americans had suffered heart attacks from taking the drug, and 38,000 of them died. An FDA official testified before the Senate Finance Committee that the agency's failure to recall Vioxx earlier had likely resulted in as many as 55,000 premature deaths, which he described as the equivalent of 2 to 4 jumbo jets crashing every week for 5 years. Merck eventually settled approximately 60,000 lawsuits for nearly $5 billion. $5 billion. And the drug had been on the market for 5 years. The reason the Vioxx story matters in 2025 is not that rofecoxib still exists. It's that the systemic pressures which produced the Vioxx situation, the pressure to get drugs to market, the financial incentives to minimize adverse findings, the gap between internal corporate data and what reaches consumers, those pressures haven't gone anywhere. They're structural features of how this industry works. 6. Aspirin long-term daily use. Aspirin occupies a complicated space in American health culture. For decades, the idea of a baby aspirin a day was practically gospel, something doctors recommended, something retirees took as faithfully as a vitamin. something millions of people still do today. The science behind that practice has shifted considerably. Aspirin does thin the blood. And for people who have already had a heart attack or stroke, that blood-thinning effect has documented benefits for preventing a second event. For that population, aspirin therapy remains medically supported, but for healthy adults who have never had a cardiovascular event, people taking aspirin preventively, the calculus has changed dramatically. Multiple major studies, including the landmark ASPRI trial, which specifically studied healthy older adults, found that daily aspirin did not meaningfully reduce the risk of heart attack or stroke, and it did increase the risk of significant internal bleeding. In 2022, the U.S. Preventive Services Task Force updated its guidelines and explicitly stated that routine daily aspirin is no longer recommended for most adults over 60 who have not had a heart attack or stroke. The bleeding risks, the task force concluded, outweigh the cardiovascular benefits for that population, and yet surveys suggest tens of millions of Americans over 60 are still taking daily aspirin based on advice their doctor gave them 10 or 15 years ago, advice that has since been reversed, without anyone telling them the recommendation changed. The gastrointestinal damage from long-term aspirin use is well documented. Stomach bleeding, ulcers and perforations are documented risks. Research has found that for some people with high gastrointestinal risk, the bleeding harm from aspirin could actually offset whatever cardiovascular benefit they might receive. 7. Acetaminophen, Tylenol, in high or repeated doses. This one is perhaps the most surprising name on this list because acetaminophen doesn't get talked about the way ibuprofen or naproxen do when people discuss anti-inflammatory risks. It's positioned in the market as the gentle alternative, the one you reach for when you can't take an NSAID, the one that's safe for children, the one that hundreds of millions of people trust completely. Technically, acetaminophen works differently from NSAIDs and isn't a classical anti-inflammatory in the traditional sense, but it remains one of the most commonly used pain and fever reducers in America, often taken by people trying to avoid the cardiovascular and gastrointestinal risks of ibuprofen and naproxen. And here is what those people deserve to know. Acetaminophen overdose is the leading cause of acute liver failure in the United States. That's not a fringe claim from a fringe source. That's the position of transplant hepatologists at Rush University Medical Center, documented in the NIH's own medical literature database. Research from the NIH notes that acetaminophen toxicity accounts for more than 50% of overdose-related acute liver failure in this country and approximately 20% of all liver transplant cases. Every year in the United States, acetaminophen-related issues are responsible for an estimated 56,000 emergency department visits, roughly 2,600 hospitalizations, and approximately 500 deaths. Here is what makes this especially troubling. The majority of those emergency visits aren't the result of someone deliberately taking too much. They're what medical professionals call therapeutic misadventure. People taking doses they believe are safe. People who don't realize that acetaminophen is hiding inside their cold medicine, their NyQuil, their prescription pain pills, their sleep aids. Each product says it contains acetaminophen, but stacking several products at once can push someone well above the 4-gram daily limit without them realizing it. One extra-strength Tylenol tablet contains 500 milligrams. 2 tablets, 4 times a day, puts a person exactly at the daily limit. Add a cup of NyQuil for a cold, which contains 500 milligrams per tablespoon, and the math changes quickly. The FDA has explicitly warned that severe liver damage may occur if a person takes more than 4,000 milligrams in 24 hours. But the UCI health system has noted, if you wait until the symptoms of liver damage appear, it's too late. The liver damage from acetaminophen doesn't hurt in the early hours. It develops silently, over 24 to 72 hours, while the person feels relatively normal. And once liver failure sets in, the mortality rate climbs to nearly 30% even with medical treatment. This isn't a product that's inherently dangerous when used correctly, but used correctly requires a level of label vigilance that the packaging, the marketing, and the general cultural reputation of this drug don't currently encourage. I want to pause here, because if you've been paying attention, that was a heavy stretch of information, and I want to be clear about something. None of this means that every person who has ever taken ibuprofen for a headache or Tylenol for a fever is in danger. Occasional low-dose, short-term use of these products for most healthy people carries manageable risk. That context matters. What raises serious concern is the pattern that emerges from the research. Chronic daily use, often at high doses, by older adults and people with underlying health vulnerabilities, for conditions like arthritis or chronic back pain, where people are essentially treating a long-term problem with medications designed for short-term relief. That's the profile that researchers and regulators are flagging, and it's also, quietly, the profile of a very large number of Americans. Think about someone you know, maybe a parent, a grandparent, a neighbor, who takes a Aleve or Advil every single morning for arthritis pain, who's been doing it for 5 years, who considers it as routine as brushing their teeth. That person's doctor may or may not have ever had a detailed conversation with them about what that long-term use actually means for their kidneys, their stomach, their heart. If you're watching this video, maybe you're that person. Or maybe you're someone who wants to understand what the safer options actually look like. Let's talk about those. Safe alternative number 1. Curcumin, from turmeric. Curcumin is the active compound found in turmeric, and it has been used in traditional medicine across South and Southeast Asia for thousands of years. But when researchers started systematically studying it, what they found went beyond folklore. The Arthritis Foundation published a review noting that a 2021 analysis of 15 randomized controlled trials found that curcumin relieved osteoarthritis pain and stiffness as well, or better than NSAIDs, like ibuprofen and celecoxib, without the side effect profile that makes those drugs concerning for long-term use. Research published in peer-reviewed literature has described curcumin's ability to inhibit the same inflammatory pathways that NSAIDs target through multiple mechanisms, reducing the production of inflammatory cytokines, dampening enzymatic activity that drives chronic inflammation, and doing so without the COX inhibition mechanism that strips away the stomach's protective lining. A clinical trial comparing curcumin directly to a standard NSAID for pain found that curcumin provided significant pain relief, slower to kick in than the NSAID but meaningful, and without the gastrointestinal symptoms that the NSAID produced in the comparison group. There is one important caveat. Curcumin in its raw form has poor bioavailability, meaning the body struggles to absorb it efficiently. Simply putting turmeric on your food or swallowing a basic curcumin capsule may not deliver therapeutic levels to the tissues that need it. What research has found to be significantly more effective are formulations that combine curcuminoids with the essential oil of turmeric, a preparation shown in studies to deliver curcumin levels in the bloodstream that are roughly 7 times higher than free curcumin alone, and to maintain meaningful blood levels for at least 8 hours after consumption. Black pepper extract, piperine, has also been shown to meaningfully improve curcumin absorption. If you're exploring curcumin, the evidence points towards standardized extracts in the range of 1,000 milligrams per day of curcumin content, the dose range used in the arthritis trials, and in a bioavailable formulation. Not raw turmeric powder. The delivery matters enormously. Curcumin doesn't carry the cardiovascular, renal, or gastrointestinal warning profile of the NSAIDs discussed above. Multiple clinical trials have confirmed it as safe for human use at standard supplemental doses. That's not a guarantee that it's right for every person in every situation, and anyone with a complex health picture should talk to their physician. But as an option for people seeking long-term anti-inflammatory support without the risks of chronic NSAID use, the evidence is genuinely promising. The omega-3 fatty acids EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, found in fatty fish like salmon and mackerel, and in fish oil supplements, have one of the most robust bodies of anti-inflammatory research of any dietary compound in existence. What makes omega-3s interesting from an anti-inflammatory standpoint is the mechanism. Rather than blocking the enzymes that produce inflammatory molecules, which is what NSAIDs do, with all the collateral effects that brings, EPA and DHA shift the body's inflammatory machinery in a different direction. They promote the production of molecules called resolvins and protectins, which actively help resolve inflammation rather than simply suppressing it. The difference is meaningful. Suppressing inflammation and resolving it are not the same thing, and the resolution pathway, driven by omega-3 derived molecules, doesn't carry the vascular and gastrointestinal consequences of QX inhibition. The American Heart Association has published research showing that fish oil supplementation increases anti-inflammatory molecule levels in the bloodstream for up to 24 hours after consumption. Those molecules also appear to make platelets less sticky, potentially lowering the risk of blood clots, the opposite direction from the cardiovascular risk pattern seen with many NSAIDs. For people with rheumatoid arthritis, the research on omega-3s is particularly encouraging. Studies of long-term omega-3 supplementation in active rheumatoid arthritis patients have found significant reductions in joint pain and stiffness, and some researchers have documented meaningful reductions in disease activity markers and inflammatory indicators. Mayo Clinic notes that strong evidence supports omega-3s for reducing elevated triglycerides, with blood pressure benefits also documented across multiple studies. Their safety profile, unlike the drugs discussed earlier, does not include boxed FDA warnings, doesn't carry kidney or liver damage risk at standard doses, and doesn't produce the gastrointestinal erosion that makes NSAIDs so problematic for long-term use. There is an important quality caveat here. Not all fish oil supplements are equal. The omega-3 supplement market has its own quality issues: oxidation, underdosing, poor sourcing, and inconsistent EPA-DHA content. If you're going to use fish oil therapeutically, the evidence points toward pharmaceutical-grade products, third-party tested, with total EPA plus DHA content clearly stated per serving. Aim for products with certification from an independent testing body like IFOS or NSF International. For most healthy adults, 2 to 3 grams per day of combined EPA and DHA is the range used in inflammation-related studies, and this dose has a well-established safety profile. People taking blood thinners should discuss it with their physician before adding high-dose fish oil, given the mild anticoagulant properties. When you step back from all of this and look at the full picture, a few things become clear. The 7 anti-inflammatories on the concern list aren't inherently evil. Several of them have saved lives. Aspirin, taken correctly by people who have already had cardiovascular events, has genuine medical value. Ibuprofen, for a healthy person with a sprained ankle and a 3-day course, carries manageable risk. Tylenol at normal doses for occasional use is not a public health catastrophe, but chronic, daily, long-term use of these products, especially by people over 45, especially by people with any degree of kidney, liver, or cardiovascular vulnerability, is a different conversation entirely. And it's a conversation that most people have never fully had with their doctors, their pharmacists, or themselves. The pattern that emerges from the research is almost paradoxical. The people who are most likely to be taking these products daily, for chronic pain conditions, are often the same people for whom the long-term risks are highest. Older adults with arthritis, living with kidney function that's already slightly reduced with age, perhaps carrying mild hypertension, perhaps taking blood pressure medications that interact with NSAIDs. Those are the people reaching for the Aleve every morning. And those are the people for whom the warnings in the FDA's black box language are most directly relevant. The pharmaceutical industry has built enormous revenue streams on products that are marketed as everyday, casual purchases, so familiar that their risks get culturally invisible. That's a business model. It works because familiarity breeds trust, and trust is more powerful than fine print. So where does this leave a person who's been taking ibuprofen daily for knee pain or Tylenol every night to help sleep through arthritis discomfort? It doesn't mean panic. It doesn't mean throwing everything in the trash tomorrow. What it means is that it's worth having a real conversation with your physician, specifically about long-term NSAID use, what your kidney function looks like, whether there are alternatives that might address the underlying inflammation, rather than just masking the daily symptom. It means checking the labels of every OTC product in your home for acetaminophen content, so you're not accidentally combining multiple sources without realizing it. It means being aware that the product society has normalized as low stakes. The pills that live between the vitamins and the antacids aren't all equivalent in their long-term profiles. And it means that the alternatives discussed in this video, curcumin and omega-3s, aren't fringe wellness ideas. They're compounds with real peer-reviewed research behind them, studied in clinical trials against the same drugs discussed above, and showing results that warrant serious consideration. I want to ask you something in the comment section below. Have you been taking any of the products in this video on a regular basis? Have you ever spoken to your doctor specifically about the long-term implications of that use? Let me know, because based on what I found while researching this, I'd guess the honest answer for a lot of people watching is no. And that conversation is worth having. The medicine cabinet is one of the most trusted spaces in an American home. It's where we keep the things that protect our families. It's where we reach when something hurts, when someone runs a fever, when the arthritis wakes us up at 3 in the morning. And most of what's in there is there because it was trusted, because a doctor mentioned it, or a commercial made it feel safe, or it worked the first few times and the habit just continued. What this investigation has shown is that trust is not the same as safety. That the most familiar products in your medicine cabinet may carry a risk profile that the packaging, the marketing, and the decades-long cultural habit never told you about. The two alternatives discussed in this video aren't magic. They're not guaranteed solutions for every person with every type of chronic pain. But they represent a different approach, one grounded in a mechanism that doesn't trade cardiovascular protection for pain relief, doesn't strip the stomach lining as a side effect of fighting inflammation, and doesn't carry FDA-boxed warnings about heart attacks, kidney failure, and liver damage. For the millions of Americans who've been treating chronic inflammation with the same daily pill for years, that difference is worth knowing about. If this video gave you something to think about, consider sharing it with someone you care about who might be in that situation. And subscribe if you want to keep seeing this kind of research-driven investigation, because there's a lot more in that medicine cabinet worth looking at closely.